Hi friends, I'm Adira Radhavan, one of the faculties from Bliss Institute Sharjah, and a warm welcome to the new sessions. So we are discussing OET speaking session. So always the usual settings we are discussing, but now we will discuss a school clinic. So sometimes questions will be rarely coming from such kind of setting, and we will be acting as a school health nurse. So the setting is school health nurse, and you may have a description. So nurse's description is that we are speaking to a student and he is an athlete. So an 18-year-old runner is there, so who has headache following an athletic event. So this is a scenario. Simply we can say that he is coming with a headache and an 18-year-old athlete he is, and is visiting to see you what is wrong. So actually the person is coming to see you with finding the reasons of headache. So after the event or after the running competitions or after running he has such kind of headache. So this is the reason he is coming with that. So here the interlocutor will be there with you and you have to find the gender based on that. So in your question you can see that he or she. So you have to choose the interlocutor's gender as your patient's. That means if it is he, you can choose he, or otherwise if it is she, you can choose she. So we are starting with a speaking section. As usual, always we can start with a greeting, a warm greeting. And in OET, afternoon sessions are coming, so you can start with good afternoon always. So it is better, and depend on the time, it can be varied. Then after this, you have to introduce you are the school nurse and always explain your passport name. What it is in that, you can say your name like that. Always be formal with that. Then we have some tasks. So there are 6 tasks in this speaking. So the first one will be regarding find out when headache began. So simply here they are mentioning that the characteristic features regarding the headache we have to ask. And especially when it is started, if it is there, you can rate the pain scale also. So pain scale rate, it is always boring. So every time we will ask the pain scale rate. But if you are making some tricks on assessing pain scale, like 0 to 10, instead of 0 to 10, you can describe the pain character. Dull pain, excruciating pain, severe pain, or something like that. A difference if you are making in pain style, it is very good if you are making. So always be different in speaking sections. So we can assess the pain or headache when it started. Then find about the student food intake today, amount, type of food, volume, type of fluid. And the next task, they are asking or they are giving some information about the food intake. So simply we have to analyze that this is based on lack of food intake. This headache is associating because of basal metabolic rate, high basal metabolic rate. The patient is tired. This is a reason of headache. So we have to correlate everything. So you can ask about his food habit, type of food, etc. Then once if we identify the reasons, next task we can make sure reassure the student that dehydration with excessive exercise is common if intake is sufficient. So whenever you are explaining, you can explain something related to the reasons of their headache. Then another task it is there that suggestions. So some suggestions regarding his dietary habit or food style, especially to increase fruit, water, juices, etc. Then another task which is giving that encourage the student to see few hours back. So simply we can say that a follow if they have persisting headache after few hours of food. Again, you have to make a follow-up with your patient. Then finally, suggestions. So something can be avoided to avoid this kind of headache in future, like sufficient breakfast, fluids. So some suggestions also will be giving in this overall task is meaning that first of all you have to discuss something with your patient and find the reasons behind headache, and you have to explain why it is, then give some suggestions. So it is a normal candidate card. So as usual, introduction you can say, then assurance should be a compulsory thing, because if anybody or any patient is coming, we have to communicate properly and we have to make a trust first of all. So assurance can be made. Simply we can state that I'm here to help you. I will find a solution for your headache. So this is one of the best sentences you can use. Then whenever you are acquiring a trust with the patient or the child or an athlete, you can move on to the type of headache, means frequency and the pain scale rate, then food habits. So one by one you can ask question. Once if you ask something or if you are collecting some information, you can relate it with their normal pattern. So for example, you can say that maybe your headache is associated with your skipped meal in the morning. So whenever you are in active state and as well as you are an athlete, so you need more energy. If you are taking less amount of food or if you are skipping the meals, means you will be tired easily and you can do only little exercise and also you have to make sure this is the reason you may get such kind of headache. Then after that, in between, check whether they are responding, or it should be an interactive phase, and make sure whatever you are saying, it will be understood by your patient. Then gradually you can suggest something, and 1, 2, 3, one by one you can describe. Then finally, if everything is finishing, you can ask, do you have any further queries? Then wind up the sessions, and especially the suggestions regarding, you can say that water intake is very important. If they are not interested in taking water, you can suggest some alternatives like fruit juices, any other fluids, or more water containing food items you can suggest. So whenever we are dealing with food or dietary habits, inquire regarding their dietary pattern. Then as a suggestion, in a non-judgmental way, you can explain more. So these all are the things related to school health clinic on the task regarding headache and with an athlete. So these informations will be beneficial for you, and keep watching on and see you with the next video. If you have any doubts, you can contact our Bliss Institute Sharjah and Bliss Academy. Thank you.